All right, guys, let's talk about headaches. So, more specifically, the health history questions for headaches. You'll want to figure out the onset of the headache simply by asking, when did your headache start? Was it gradual? Was it over hours? Was it a day? Did it come on suddenly over minutes or less than an hour? And have you ever had this type of headache before? Other than simply asking about the headache, you want to specifically ask, where is your headache? Is it your entire head? Is it frontal? Is it temporal? Is it located behind the eyes? Is it in the sinus area, perhaps? Or in the occipital, behind the head? Is the pain localized on one side of the head? Or is it sort of all over? Asking about the character. Is it throbbing? Is it aching? Is it mild? Is it moderate? Is it severe? Maybe you'll ask your patient to rate the headache on a scale of 1 being very minor and 10 being the worst headache ever. You'll want to know a little bit more about the course and the duration of the headache. So when do the headaches occur? Do they awaken you from sleep? How long do they last? Are we talking hours? Are we talking days? See if you can find out some precipitating factors of the headaches, like what brings it on. Is the headache brought on by activity or exercise, perhaps the work environment, maybe emotional upset, anxiety, alcohol? You want to try to figure out too, are there any signs of depression from your patient that may be a contributing factor to this headache? And any associated factors with the headache. So nausea, vomiting, we see these things oftentimes with a migraine headache. Any vision changes, any pain with bright lights or photophobia, neck pain or stiffness, fever, weakness, moodiness, or any type of stomach problems. Other questions you'll ask is, do you have other illness or take any medications? Do you have any family history of headaches? How frequent are the headaches? Do they happen once a week or more often or less often? And for females, you'll want to ask, do they occur in relation to your menstrual periods? See if you can figure out things that help the headaches. Does sleep help? Do medications help? And any coping strategies. How have the headaches affected self-care, your ability to work, your home life, and your social ability? And then final questions. Was there any type of head injury or a blow to your head? Do you have any associated dizziness? Is there any neck pain or limitation of neck motion? Any lumps or swelling? And is there any history of head or neck surgery? Next, we'll be jumping into the case studies.